Hi, my name is Deborah, and this is my second video on the topic of thumb osteoarthritis and suture suspension arthroplasty surgery. So I'm hoping my videos here will help you, if you have thumb osteoarthritis, decide whether or not to have surgery. And if you do decide, it will help you be better prepared for what's to come. So first of all, thumb osteoarthritis is a degenerative disease. It means the cartilage is wearing out on a saddle bone at the base of your metatarsals in your thumb, at the bottom by your wrist, that your thumb rotates on. And when that cartilage wears out, you become bone on bone, and it's painful. Your hands feel weak. It's harder to do things. You have to constantly maintain the inflammation, and it starts to limit your activities. So after dealing with this for a while, I've noticed in my late 50s, early 60s, that it was getting worse and worse. And the pain, of course, would flare up when you do certain activities, and you'd cut back and not do anything because you're in too much pain. I decided I really didn't want to live with this because I have an active lifestyle and I didn't want to have to modify my activities. So I started doing some research, and I really appreciated other videos that some people put out there on their experiences, in addition to academic research that I had done on surgeries and the success rate, and I decided to do the surgery. The success rate is pretty high. It's 96, 98%, and I use Dr. Stephen Lee at the Hospital for Special Surgeries in New York City. So there's 4 stages of this disease. I was definitely at 3 in both hands, and I might have been at 4 in this latest hand because the pathology report said I had absolutely no cartilage, and I was completely bone on bone, while my non-dominant hand, my left hand, might have had a little left. And that was my guinea pig. I said, let me do my dominant hand to see my results before I do my dominant hand. Anyway, I had surgery 9 days ago in October, and November. And I'll tell you what to expect. You go in for surgery, you wear loose clothing, they prep you for surgery, they give you anesthesia. It's the same anesthesia you get when you have a colonoscopy. It's propofol. So the recovery from that is great. It's like you don't even feel like you went under surgery. It's not like, I don't know what drug they used in the old days, but I remember having anesthesia and you felt pretty crummy afterwards, nauseous and all that, nothing. And they give you, before the surgery, a nerve block so that it numbs your arm. And when I woke up from surgery, and again, surgery is about it. Well, let me back up. Surgery is about an hour and a half. And when I came out of surgery, I felt great. But your arm is numb. But luckily this year, it didn't stay as numb from this point to my shoulder all the way down to my fingers as long as last year when I had the other hand done, which I was very pleased about because I didn't really like that feeling of not feeling my arm at all and carrying this dead weight around. And so I would say just within a few hours after surgery, I was able to even do this, like lift my arm up. I had some control over the arm. Otherwise, you keep it in a sling. You keep your hand, your surgical location above your heart because you don't want your fingers to swell or to minimize swelling. And you have to do that for a couple of days after surgery. So between the sling and using pillows at night, I successfully did that and my fingers didn't swell. Pain wasn't that bad. I was on a regimen every 4 hours, alternately between Tylenol and ibuprofen. And if I felt I needed a little extra, they sent me home with 4 2-milligram doses of oxycodone, which I used in the course of 2 days. By the time Monday morning rolled around, I was already starting to feel better. I turned the corner on the pain, and I didn't need to keep that 4-hour regimen. Instead, I just took it as needed. So it was really good. I had a very good post-op experience, even better than the first time. It probably was because I was more emotionally prepared for the surgery as well this time. Now, post-op cast. When you go into surgery, make sure you come with a short sleeve or a loose sleeve garment. I have about 3 sweater-like garments or long sleeve garments that are large enough to fit the cast in, because you can see here my cast is about 5 inches wide by 3.5 inches. It's a little bulky. It's not that heavy, it's just bulky. And this will come off now on Tuesday. So for me, that would be less than 2 weeks. And then an OT person, occupational therapist, will make a custom cast that I will be able to remove in the evening when I shower, which would be really nice. And otherwise, you have to leave it on for another month before you start OT twice a week. Now, with regards to the cast, when you want to bathe, you should buy yourself before the surgery on Amazon. There's these waterproof sleeves for $15. I put that on whether I'm showering or bathing. My husband did help me the first day and the day after with regards to those things, but otherwise I became pretty independent, and you get really good at using these fingers. You can use your other 4 fingers, just not your thumb, your hands, your knees, your body. You know, when you need to do things, you figure it out, and I've gotten to be pretty independent. Your hair, if you're someone who needs your hair fixed, well, maybe it might not look good for a while unless you show your husband or somebody in your family how to fix your hair. And with regards to cooking, minimal stuff. I wouldn't use a knife for a while. You know, again, your thumb is out of commission for almost 2 months before you start OT to regain that strength back and your functionality. So this week, when I go in, they're going to remove the cast, they're going to remove my stitches, and then put that custom cast on. And again, that's going to be much more streamlined, and I'll be able to fit in my other clothes. That was my experience last time. So that's about it for this video. I'm going to try to post things going forward to give you an update on how I'm doing. Otherwise, I really hope this helps a lot of you out there that are on the fence about whether to have surgery or try to live with the disease. The only thing I have to say about living with the disease, no one can tell you whether it's going to get worse or stay the same. It will never get better. It is a degenerative disease, and in most cases, it does progress and get worse. In fact, your hands, aside from being weak, and living in pain, you could develop over time bone spurs, which start to make your hands look deformed. And I don't know, I didn't really want to find out, especially since the success rate of this surgery is so high. I figured, let me go for it, you know. And it's really nice not to be in pain all the time. Every time you do a little thing, like even use a, you know, I don't know, a tweezer or a Q-tip. So I have to say, based upon the success of this surgery, I was ready to go and do my next hand. So I hope this helps you, and stay tuned for my next video.